I'm a urologist, and I see a lot of patients with prostate enlargement, and I want to give you an idea of what happens with prostate enlargement, why it gives you urinary symptoms, and what we can do to help alleviate those symptoms. The big mystery is, why does the prostate affect the urinary stream if the prostate is not part of the urinary systems? And I will show you on a model where the prostate is, how it's actually causing the urinary symptoms, and how we can help fix that problem by opening up the prostate. So I'm going to go to this model right here, and I'm going to show you that this is the bladder, and this bladder contains the urine, and when the urine wants to come out, it goes through this passage here. The passage is called the urethra, and the passage, it goes through the prostate, and when the prostate gets enlarged, the prostate starts crushing in on that urethra. So now, instead of having a nice big passage, you're going to have a tiny passage. Start getting very thin, so now it's very hard for the urine to go through. And what we can do to help that is a procedure called the Urolift. The Urolift is a small clip that we put on either side of the outside of the prostate as well as the inside, and it helps open up the passage, just like you opening up the curtains. So for example, here, if I put the Urolift clip on this side, which is the prostate, on this side where the prostate is not enlarged, you will see that the prostate is not going to change anything. Because the clip is the same width of the prostate, so this would not change anything in this case. But on this side, if I anchor the outside of the clip on the outside of the prostate and then bring the inside of the clip on the inside of the prostate outwards, the tube is going to get enlarged. And as the tube gets enlarged, we're going back to the situation that the patient was in when they were 20 or 25 years old. So basically, the outside of the clip, the outside clip goes on the outside of the capsule of the prostate, and we do one or two here, or even three sometimes, depending on the size of the prostate. And same thing on the other side. One clip goes on the outside of the capsule of the prostate, and the other one goes on the inside. So now this tube here is getting opened up. And then this tube is getting opened up because we put one clip here, another one here, another here. So now the prostate passage, the passage inside the prostate, which is the urethra, gets opened up. And if it gets opened up, now the bladder is going to be able to empty the urine. As the bladder has a bigger passage to get the urine through, all the symptoms start getting better. The symptoms that you're going to have with an enlarged prostate are like frequency, urgency, getting up in the middle of the night to pee, having to go several times to go to the bathroom before you can empty your bladder. Sometimes people have a very weak stream. The stream doesn't come out so well, so that way it takes forever to empty your bladder. And even when you finish, your bladder is not all the way empty. So all these symptoms of the urinary symptoms that the males start having when a man gets to be over 50, most typically.